In the upper torso and the neck region, we oftentimes encounter this collapsed condition. People, through sitting with computers, driving, a lot of activities that are done, unfortunately, with poor posture, cause this collapse. This is also affecting the lung capacity and a lack of breathing up into the upper lungs. Now, of course, breathing into the upper lungs is important to supply the body with oxygen, but it's also an activity inside the body that helps maintain the proper alignment on the outside. It keeps the shoulders upright, it keeps the chest out. Once that starts to collapse, it can also begin a syndrome of other problems that start: poor circulation, poor air supply to many parts of the body. In this technique, what we want to do is to revive that part of the body and to jumpstart it, to give that part of the body, the upper chest, therefore the upper lungs, and partially into the neck. We want to give it a jump start. We're going to start out with a more easy way of doing this and just slip our hands underneath. I'm on the inside of the shoulder blades and on the sides of the spine. So that would look something like this. I'm slipping in and I'm right to the sides of the spinous process. Okay, so this is where the placement of the hand is going to go. Here's the shoulder blade. I'm on the inside of that. Here's the spine. I'm above that. So I'm in the space between the spine and the scapula. There's also a number of important muscles here. We know the meridians are flowing through there, but this is also affecting the upper chakras, energy centers, and these upper organs, heart. I'm going to ask the receiver to breathe in, and breathe out. Breathe in, and breathe out. So what I'm doing is just using my fingertips like this. Again, I'm bracing my elbow against my knee, my thigh, and that gives me leverage. So I'm not straining the wrist or the muscle in the forearm. I'm getting the force actually coming from the hara. Now I'm going to start out more toward the upper part. Breathe in, then breathe out. And each time I'm going to reach a little bit deeper. Breathe in and breathe out. Breathe in and breathe out. And we can usually get down to the lower tip, the inferior tip of the scapula. Breathe in and breathe out. Now, as you do this, you can feel the effect of the rib cage moving, the shoulders moving. Breathe in and breathe out. So that's a really good way to jumpstart the energy and get the breath really coming up to this upper part of the body. Another way we can do this, and we see some of the traditional practitioners, the ones that use their full body, really engage their whole body with the client. We can take the arms like this and create a stretch. Breathe in and breathe out. Take the arms and just free them up like that. Lift this part and slip your feet underneath. Part of the foot that's contacting the body is basically at the same place where the hands were. You open up more by having the arms above. Breathe in and breathe out. Slip down a little further if you can. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. One more time. Breathe in and breathe out. Now, hopefully you're going to get somebody to practice on you so you can experience how that feels. It's an interesting sensation. There's a lot of movement happening in the upper area. There can be warmth. You may feel tingling along the spine, in the scapula, the shoulders. So those kind of sensations are also showing that we've really activated the chi in that area. Again, when we have this kind of collapsing posture or just tightness there, stiffness in the neck, this kind of movement helps to restore the natural condition to this part of the body. Lift. Breathe in and breathe out. Breathe in and breathe out. I'm going to reach in a little bit more here. Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out.